All right, good afternoon, everybody. Thank you for joining us here for the last session of this first day of our conference here. We had a little pre-conference summit workshops. You're in the leading transformation track here, and we're here to hear from another CEO. If you were in the previous session here where we heard from the CEO of a health center who's just starting his transformation journey, and wow, that's loud. And so just starting the transformation journey, and now we're going to hear from another CEO who is looking at or who's practicing data-driven healthcare leadership. The session will be kind of co-moderated by my colleague Kathy Latender. My name is Chris Master. I'm the founder and CEO of Ingenium Digital Health Advisors and Healthcare Advisors. And then we have Dr. Jeffrey McKee from the Community Health Centers of Burlington, which is Burlington, Vermont, so way up north there. And he's going to be joining us here virtually, and Kathy will be presenting here in person. So with that, I wish you a wonderful session. Please help me welcoming Jeff and Kathy. Thank you.
Great. Thanks, Christian. So I'm really excited to share the virtual stage with Jeff, my colleague. I've known Jeff over 20 years and have really watched his voracious appetite for using data. It's truly transformed his leadership approach over decades, and he's going to share that story with you. But we'd like to just get a sense. We have no conflicts of interest in terms of the content that we're sharing. And I think we have many virtual participants as well. But here in the room, just want to get a sense of, who's in the room. Do we have any clinicians in the room? Great. What about coordinators or supervisors? Okay. Department managers or program directors? Great. And what about any senior leaders? Okay, great. So a good mix of folks in the room from all different levels of leadership. And as well online, sort of a similar mix of folks. Great. So I'm going to have Jeff virtually kind of just tell you a couple minutes about what he brings to this conversation in his different roles.
Yeah, so thank you, Kathy. I started as a clinician some 30 plus years ago. I'm a clinical psychologist by training, and even in that venue, found that using data to share back with people objective information about their behavior and about what they were seeing was so much more effective at invoking behavior change than just kind of telling the narrative over and over again. And so I've continued that work for the last 30 years, bringing it to various levels of leadership through various organizations. And Christian mentioned the asking people where they were on the journey or helping people along their journey. I guess what I would say as preamble to what our talk will be is that you're always restarting the journey at some level. And so it's a cycle that continues and continues, but it's worth doing.
Great. Thanks, Jeff. So I spent most of my career as a healthcare administrator leading transformational change, and data, fact-based management has always been a part of it. Because to know where you are in the journey, you need some data, you need that feedback. And Jeff has always been, is a longstanding colleague, and I've always just admired the way that he brings data. And so largely this presentation is about Jeff's journey through his different roles. But I just want to paint a couple of high-level concepts about, how does fact-based management factor into becoming a high-performing organization. Some of you may be familiar with the organizational excellence framework called Baldrige, and Baldrige is really just a model of excellence. What does it mean to run a high-performing organization? And as this graphic, I love this graphic because it shows that measurement and analysis as sort of the motherboard of an organization. And the excellence framework asks the question, How do you measure? How do you analyze? And then how do you use that information to improve performance? And so this is always the lens through which I think about fact-based management. How do we select the right measures? How do we analyze that data? How do we analyze those measures to know how things are going? Who looks at the data? How frequently do they look at it? And who are they with? Who is the body of people that are looking at what data? And then most importantly, how do we use that analysis, that review of information to make improvements and to make decisions? In many organizations, but not all, there's sort of this hierarchy of measurement information. And so in some organizations that are starting out, this is a new concept of putting in place measures at all levels of management and leadership. But in higher performing organizations, this is sort of the fabric. There are certain numbers that are reflective of how well we're performing as a system, how well we're doing against our strategic goals. There's other charts and measures that are being looked at monthly, weekly, sometimes daily at that operational leadership level. And then really importantly, ensuring that we're putting data for decision-making and management into the hands of work groups to monitor, sometimes on an hourly basis or a daily or weekly basis. So that when we improve with the limited resources that we have for improvement, we can really target our improvement efforts based upon what the data is telling us, where the facts are leading us. And so with that context, I'm going to turn it over to Jeff to talk about the ways that he has approached the use of data to engender excellence, both as a program director and then as a health system vice president, and now as the CEO of a federally qualified health center.
So thank you, Kathy. And so my talk is going to be, I think, more on the leadership components and what to bring to the leadership conversation that you're having with your teams and your staff, and trying to get them oriented towards changing culture that will help you achieve excellence, not in just a few places, but in excellence as an organization, excellence as a service line, excellence as a department, however you define that. I'm going to talk less about the kind of the technical aspects, although as a truly fully admitted data geek, I will gladly do that with anybody who wants to talk data and data analytics and the details of it. But I wanted to start off with a case example and say how from that journey that Kathy mentioned, or my progression as a professional, from clinician to manager to director to vice president to eventually CEO. As I mentioned, at each one of those steps, you had to kind of start over. But talking about that journey is helpful, I think, also to let you know that there is a business case for it. There's a clinical case for it, that if you continue on, you can achieve excellence. And one of the things that I'm most proud of is my work under my at the community hospital that I was employed by, and we have a large, by Vermont standards anyway, large inpatient psychiatric unit, 20 kind of general admission beds, involuntary patients, as well as a 6-bed intensive psychiatric ICU. And we had a philosophy that was oriented towards minimizing to the fullest extent seclusion, restraint, and other involuntary procedures, or as the note here says, emergency involuntary procedures, or EIPs. And so we were committed to that as a philosophical method of caring for patients. And we were struggling with, how do we move the needle on that number? We look at the national numbers, which, combining your seclusion and restraint, average nationally is just under 1 hour per every 1,000 patient hours of seclusion and restraint. And we as an organization, we were about that. We weren't horrible. We were about the midline, but it wasn't reflecting our incredible commitment to that philosophy and the work we were trying to put into it. And what we found as we just try to do an analysis of that is that regardless of our philosophy, we allowed single events and the narrative around single events to continually draw us back into policies and procedures that kind of took us away from that mission. All for good reason, right? All because we wanted to protect staff or we thought we wanted to protect patients. But it took us away from our commitment to the larger goal whenever we changed our policies, procedures, or practices to accommodate for some perceived risk in the environment. And ultimately, we understand that if we're continuing to do things that are contributing to more EIPs, that risks harming patients and risks harming staff. And so we struggled with that. And so what we brought forward in that environment was a challenge, which was what I call radical acceptance of the data. It is what it is. My staff, I'm kind of known for saying that over and over again, and that's okay with me. Becomes a little bit of they razz me with that occasionally, and that's truly okay in this context where you got to stop fighting the data. You got to stop pretending that the data doesn't apply to us. You got to lean into it. And yes, we're special. We're all special, but we're not more special. We're all unique. We have our individual things, but you're not more different than everybody else. And so you got to get over that. But that's an easy way to dismiss the data, which will invariably keep you from achieving excellence if you allow that conversation, the I'm special conversation, to dominate what you're trying to do as an organization. So our work, we had huge quality improvement plans and teams. It was not just about data. It was a lot of other kinds of work. And the data was the support. And without the data, it couldn't have happened. But there was a lot of other work. We had consistent collection of data with integrity, weekly review at multiple levels, public sharing, accountability. It is what it is. As a leader, I felt strongly that you have to own that accountability and own it is what it is. I can't tell my staff it is what it is and then massage the data to go in front of the board or massage the data to go in front of the, but we had a statewide EIP review committee. It is what it is. That means if it was ugly and bad, I had to deal with that, and we would deal with that. We weren't going to put fancy language or flowery language around that. And then the result was, over time, putting data in front of people, tracking our progress, celebrating the small wins, having people see that they have an impact on moving the needle. Our staff engagement scores were up consistently in the 80th plus percentile on the national benchmarks. The kind of palpable pride in the unit reflected. We had much lower turnover and higher recruitment success. The culture on the entire unit changed, as did our alignment top to bottom on these issues. And the kind of the culminating event of this was having gone from this place where we were trying to just keep pace with the national averages to having been a leader in reduction of EIPs in Vermont, by far in Vermont, in a state that already leads the other 50 in its elimination of emergency involuntary procedures. So we had our rate consistently less than half the national benchmark month after month. And in some months, we actually had events or months in which we had 0 events of any seclusion and restraint, which was an amazing challenge given that we have, like I said, a level 1 intensive psychiatric ICU. It was a great journey for us. The bottom line, if you want to change it, you need to track it, though. If you can't track it, you're not going to get people to move away from the narrative and into something that helps you achieve excellence. Oops, Kathy can, yep. So data is just the start. Data is not the goal. We talk a lot about data, and we often mean the whole hierarchy of things that data can be used for, but that's really just the tip of the iceberg, or the foundational component, rather. To data, we need to add context. We need to understand, kind of the operational definitions of the data, to which we need to add experience, and that gives us knowledge. Is the data relevant? Is the data important? We need to know that. And then adding to that, we need to add your analysis. You start to approach wisdom when you can understand what happened before and what happened after and what that connection is through that whole process, through analysis. And you can start making predictive kind of statements. But the key to it all is doing all of that really hard work and eliminating excuses. If you don't eliminate the excuses, you're not going to achieve excellence. And so with that model and that framework in mind, I really like to think about something I carried forward from my clinical days, which is the stages of change. And some of you in clinical work or in public health might be familiar with Prochaska and DiClemente's stages of 6 stages of change. And it's really impactful from a clinical perspective to move both clinical and non-clinical populations forward in different kinds of behavior change. It's also really helpful framework to try to move organizations forward in change. And so from pre-contemplation to contemplation, preparation, action, maintenance, and then relapse or recommitment is a natural cycle. And so, as I said a couple of times already, starting over is part of the process, or starting anew in another area. You're always kind of moving through these stages in one form or another. Yeah. So I'm going to go through each of the 6 stages and kind of talk to you about what you tend to hear in these stages. And as a leader, how you can respond to that to help move your teams forward through the journey. So in the pre-contemplation stage, you're not committed. You're ambivalent about whether or not this whole data journey is something we need to actually engage in. You're focused on the mission. You hear that a lot, as many of your organizations are, like mine, incredibly mission-driven organizations. We do incredible work, and it's hard to argue with. We're a mission-driven organization to get someone out of that focus on just providing the best care they can for the patient in front of them. So you got to find some strategies to help move forward. I would say, as a preamble to kind of this pre-contemplation stage, and think about if you're starting at this level, how to move folks forward. If you have the luxury of working with any layer of clinician, moving clinicians from pre-contemplation to action is one of the easiest groups. They're all overachievers. They're all used to getting A's. They're all used to being at the top of their class. And they're motivated kind of characterologically to be the best. And they're also very science and data driven. And so if you can just make a bit of a case for it and get them just a little bit to look at the data, they'll start to move your system forward for you. But you got to challenge them to look at the evidence. How do you know? Beyond the narrative, how do we know? And how do we demonstrate? If we're really that good, if we're really as good as we want to be, as good as we say we are, how do we demonstrate that to anybody? And when I often have the conversations, and people will admit, we have pockets of brilliance and excellence in this organization, the one I'm working for now, and in every organization I've worked for. What we hadn't had is data that helps us demonstrate that we're doing it every time and consistently across the organization. That's where the data comes in. It's not to take anything away from the excellence that we know exists in the organization. And best practices, and what's the model out there that we can follow. And then you move, hopefully people move into contemplation, which is, okay, we heard you, yeah, data is important, but I'm not sure that it applies to us. We're different. My caseloader is harder, more complex and different. And again, you're special, but you're not more special. This is where we start to respond by leaning into the commitment to the mission and professional excellence, looking at the pros and cons. Don't be afraid to kind of put that list out there and have that conversation openly. It's not just a mandate. Help them, invite them into that conversation about should we or shouldn't we. And largely clinical-oriented folks will say, yeah, we absolutely should try to track the data and move in that direction. And back to that idea of radical acceptance. The data is what it is. It's got some flaws in it. It's got some error in it, but we're going to lean into it. Validation increases with use. And you got to keep that in mind. Often your early attempts at data will be fraught with elements perhaps from your EMR or your data collection that haven't, because no one had watched them, aren't completed correctly all the time. That's a process you will work through, and eventually it becomes more valid. Preparation, getting ready to do the work. We got the early buy-in. We got people convinced that data is important. They're going to invest some energy into it. How do we plan to do this? We don't just do data because someone had the nice notion. It requires a plan. And then you start getting the feedback. This is difficult. It may be too difficult. The thing you hear more often of these next two is, well, if we're going to look at that, we also need to look at this and this and this other thing that are connected to that. Or that's the broadening kind of stall. It's not intentionally a stall tactic, but that's what it ends up becoming. The over broadening, or the last one there, which is the ultra granularity approach, which is, well, can this be broken down by left-handed people who access care on Thursday evenings? Well, we don't, kind of say, well, no, we're never going to look at that. We're going to say, we got to start somewhere. We got to start with the data we have. We got to have to start with the data we have at hand that's easy to get. And once that's anchored and we know that's reliable, we can start to get to that next level of granularity. And perhaps that analysis will fit in. And our knowledge and our wisdom and our approach of excellence will get more refined over time. And so don't let the enemy be the perfect of the good. Or don't let perfect be the enemy of the good. I'm sorry. People will want to say, well, your data has error in it, and so it's not ready to be shared, or it's not ready to, it's not meaningful. I think it's still meaningful, and it's still ready to use. You need to understand the asterisks that need to be placed on it. So we shouldn't be making overreaching decisions based on data that has error in it, but the data is still telling you a lot. And so get started. You can try to get that data refined and perfect before you start an initiative, and you will never get moving on your actual initiatives, in my experience. You got to start, take the data for what it's worth. Validation comes across time. And then also acknowledge that some measures are proxies, and that's okay. I'll give you an example here at our primary care clinic. I don't have good metrics for patient cycle time, from time of arrival to time they leave. For any number of reasons, the data is just not available to us in a way that is worth it for us to invest the resources to make it accurate at this moment. But what I do have is I know what time the patient's appointment was supposed to start, and I know what time the patient checked out. And so that's a proxy for a lot of things. Now, the clinicians, some of them wanted to know how much time it took with this person, how much time it took with that person, how much time it took with this other person. Great stuff to have if we could get it. We don't have it. Are we still concerned about how long it's taking us to move patients through? And can this other data that we collect around patient appointment time and patient checkout time and that cycle time? Absolutely. And so that's what we're going to go with here, have been going through with here. So as an example. Action. So you're moving forward. And some of the constant refrains come up. Is all this necessary? Again, the data isn't accurate. This is a lot of time. I'm not sure I can continue to do this. And this is where you come in as a coach and as a cheerleader. Kathy, can you hit there you go, thank you. And so keep focused on the goal. I've got what I call my broken record speeches. They know what I'm going to say before I say it, but I keep remember we started this process when we created this quality initiative, whatever this initiative is. We're doing this because we want to reach this other point that you're really committed to. It's pretty much the various versions of the same statement over again about the why. Why are we doing this? Why are we doing this? Lots and lots of cheerleading on process, even when the outcomes aren't bad. The fact that you're tracking outcomes and you're owning the data, that you're practicing radical acceptance of the data, that is in itself progress, even though the outcomes aren't what we would want them to be in many cases early on in a process. And celebrate the small wins and celebrate individuals. Keep them motivated. As a leader in this process, if you don't demonstrate that you really care, and you shouldn't expect your teams to put in more care than you do to this process. So, maintenance. So you've gone through all this. You've got people energized. You've got them making some movement. They're tracking the data. Maybe you're showing some good outcomes. And one of the hardest parts of all of this is maintenance. Give me a crisis, give almost any healthcare leader a crisis, and we rise to the challenge and we can do it. We can marshal our teams, we can get the energy up, and we can get it done. Maintenance, the day-to-day kind of maintaining it, is ridiculously hard because we're trying to maintain things while we all still have those crises coming at us. And so, it is just the biggest challenge. And so what you hear is we're different. My caseload is harder, more complex, and different. Same stuff you heard at the beginning. Plan for refresher trainings. Continue to celebrate. Look for pockets of backslide, and keep the energy moving forward as best you can. But most importantly, it's the next step, the last of the 6 steps, which is plan for growth or relapse. Understand that this is part of the cycle, and don't let your projects devolve or kind of just fade away. Plan a review and a recommitment or a stopping of the process. We've done it, we've achieved it, or we're starting over, or we're moving on to another thing. Almost the worst thing we can do as leaders, I think, in terms of getting people to move forward in their acceptance of data and quality initiatives, data-driven quality initiatives, is to let things just fade away. You'll get people asking, is it anchored? Do we still need to do this? And the answer is yeah, but plan those things. We're going to make a thoughtful decision to either stop or move forward in another direction. And the good news is, starting over if you need to, it goes so much quicker the second time if you've had a little bit of success in that first go around. And so I just want to move on, but I hope anything, other things for people to think about, I think, as you think about your data journey, is your leadership team, your champions, data governance structure, how you're going to train folks, data storage and management, sharing is incredibly important, and what your analytic tools are. Glad to answer any questions about any.
Great. Thanks, Jeff. So we'd like to open it up to questions. Again, use the microphones if you're here in the room. And if you could show us if there's any online questions, that'd be helpful too.
I'll actually start us up with a question because thank you, Jeff, for that presentation. And actually, if we can see Jeff still on the screen, because this question is for Jeff here. You talked about the difference between data and narrative, and I would, and that kind of perked my interest because I've never heard it described this way. So, what do you mean by narrative, and how do you differentiate narrative from data? Thank you.
So, and when I say narrative, I'm referring to the wonderful single example that somebody might say that exemplifies your commitment to your mission or the excellent service you provided on a single case. Right? For me, that's the narrative. It's that story. It's a single episode case-based story. It's one data point, or maybe a couple of data points get clustered together. But data kind of gets you to that much broader trend and objective data, not just someone's subjective interpretation of a single event. It's anchoring it with metrics, anchoring it hopefully with benchmarks as well to understand, was that thing that happened, did it exemplify what we do every day, or was it a one-off?
Great. Other questions? Great. Okay, good. Well, great. Just a couple of closing pieces then. And Jeff is certainly willing, as he's on the last slide, I have his email address. He's happy if folks want to reach out to him one-on-one as well. He's happy to talk further. So just a couple of kind of closing slides then. They're just going to tee it up here for me. So there's so many different roles in a transformation, whether that's an organizational transformation to excellence, like Jeff is describing, or a digital transformation of a service line or an organization. There's certainly the role of leadership and management and the board. with each and every part of the organization better off when they have the facts, when they have the data to set priorities, to know that we're achieving the priorities, to manage and improve and know that the improvements are making a difference. And to have a board who's focused on those outcomes and the results and accountability for such. And as we've talked about a number of times in a variety of the sessions, managing change is often the hardest part. Raising awareness, creating the desire for change, providing the knowledge, the ability, and the reinforcements. And there's lots of different parts to change, but I think data and the story that comes from the data can perpetuate and move the change forward. And when we have all those pieces, we can create successful change. Data provides the opportunity to create awareness. Data can help create desire and combat resistance. Data gives us knowledge. But we have to equip people with the ability to use the data, or else they'll become frustrated. And as Jeff has said, that reinforcement is so important. Being willing to start over, but not going backwards. Making it an evolution, a 2.0 and a 3.0. And so as you continue to improve your organizations and the transformations, not worrying about big data, but using the little data that's in front of you, displaying it in usable ways, that visualization of the data and sharing it leads to action, and equipping your managers with the skills to analyze and interpret the data and with a mindset to continuously improve. A number of important building blocks as you kind of continue on your own data journeys in your organizations, equipping your teams with these skills to improve. And so we thank you for your time, and happy to stick around and answer any one-on-one questions, and enjoy your evening. I think the networking and reception is next, just next door. Thank you.